Oral minoxidil has been gaining its popularity to treat hair loss over the last few years. More and more doctors are now willing to prescribe it. But that's not always been the case. There are some serious potential side effects associated with this drug, and some of them can even lead to death. I've been using oral minoxidil myself over the last 3 years, and today I will reveal all of my findings. Oral minoxidil tablets have been approved by US Food and Drug Administration, FDA, to treat high blood pressure in 1979. However, it's never been without problems. Original label has put warnings on potential side effects such as increase in heart rate, rapid weight gain, increased difficulty breathing, etc. And later studies showed it can even have worse side effects, and even dying from it. So why did people recently start taking oral minoxidil tablets again? Well, in the original leaflet itself was noted that about 8 out of every 10 patients who have taken Lonitin noticed that fine body hair grew darker or longer on certain parts of the body. Such news, of course, attracts all kinds of fanatics. And when it comes to hair loss, there are plenty of people, much like myself, who are willing to try it. Out of desperation, I guess? Ever since it's been approved for high blood pressure, there were numerous studies done on various doses. Some of them go as low as 0.25 mg a day, while original high blood pressure dose was ranging between 10 to 40 mg a day. It's been found that the side effect profile has been greatly reduced with much lower dose, while at the same time still seeing hair growth benefits. Most notable side effects on lower doses were hypertrichosis, which is a growth of unwanted body hair, or wanted perhaps? And hair shedding. It's usually a sign that medication actually works for treating hair loss. There are of course more rare adverse effects such as fluid retention, heart palpitations, ECG alterations, etc. But these were in a very low numbers, which would require patients to stop the medication. It's important to know that these side effects actually went away after discontinuation of the medication, or at least that's what the study suggests. Ever since the New York Times article published on August 2022, titled "Old Medicine Grows New Hair for Pennies a Day," doctors say, created quite a stir in the hair loss world. Even by looking at Google Trends, we can see the spike of oral minoxidil research since this article has been published. This led more and more people, as well as doctors, to look into this drug again. And with more recent studies available, proving great efficacy and great side effect profile, it took the world by storm. That's me, Mr. Rolandas. I've decided using myself oral minoxidil tablets after my second transplant, which was now a little over 3 years ago. It's been fun on games with some great results. Until recently. At some point after being on it for around 2.5 years, I've noticed I've been getting out of breath. For example, when I have a quick run, mostly to catch a train, because I'm always late. At first I didn't think much about it, since I've always hated to run, and my cardiovascular health must be getting worse with age. Right? But sometime after that, when I was chilling on the sofa watching some Netflix, I experienced something strange. It felt like the area around my chest felt somewhat tighter, like it's quite literally someone is squeezing it. It's nothing dramatic, it was very subtle, but it was certainly something there. This has lasted just a couple of minutes and then it kind of went away, so I really didn't think much about it. Until this happened again a few days later. At that point I thought about it and then I remembered that there is a potential side effect of oral minoxidil, which is called pericardial effusion. It's essentially a buildup of fluid in the space around the heart, which if left untreated can quite literally kill you. And while I decided not to stop oral minoxidil on the spot, I've immediately booked myself through a series of tests through my GP practice. I thought if that's the cause, surely we're gonna be able to see. So I've done electrocardiogram to see how my heart is beating, whether there are any abnormalities, echocardiogram to see if I have any fluid buildup around my heart, chest x-ray to identify a cause of breathlessness and pain in the left chest, a series of blood pressure readings, as well as an extensive blood work. Surprisingly, I managed to get all of those done in a matter of days. I guess I just got lucky at that time, because you normally need to wait weeks for an appointment. Unfortunately, I'm still waiting to get access online to see my medical records. Hi there, I would like to request an access to all my tests that I've done, especially recently ones.
So what I'll do next is I'll send you a link to your email address with the questionnaire that you have to fill out first.
Any ideas how long it will take?
As soon as the GP reviews your application, they will be able to grant you access to your medical records online, okay?
Yep, sounds great, perfect. Bye-bye. But while we are waiting, I will explain to you my experience while taking oral minoxidil. My hair loss went so far that I pretty much lost most of my hair at the top. However, I still had quite a lot of fine miniaturized hair on my crown and temple peaks. That's where oral minoxidil would come in place, giving me a chance to prevent a third hair transplant. Spoiler alert, it didn't. I've looked into a lot of oral minoxidil studies myself. I've done videos discussing this topic as well as looking into said studies on my one of my live streams. I was convinced this is exactly what I need. I started taking it immediately after my second hair transplant back in June 2021. Pretty small pill, let me take it out first. I've started with 1.25 milligrams a day, and after a month, without seeing any negative side effects, even one guy said,
"Oh, this guy Rolandas, he has no side effects for anything."
I've increased the dose to 2.5 milligram a day. This was still on a lower end of normally prescribed dose, which was 5 milligram a day, but I've decided to take it easy. You know, not fancy dying. Fast forward a year, and I've seen some success with it. My thin hair got longer and thicker, just like promised. I have not experienced any side effects by then, and coming into year number 2, I felt like the progress have pretty much stopped. So at this point I've looked great, but some parts of my crown have still looked quite thinner compared to the transplanted area, as you can see. It didn't really bother me that much, hence I've decided not to, increase my doses any further. After all, according to studies, oral minoxidil is dose dependent, meaning the higher the dose, the more positive as well as negative effects can be had. And since I was doing well on 2.5 milligrams a day, why risk it? So I was living my life, not quite worrying about hair loss, until Dr. Ferreira, which is my hair transplant doctor, offered me a third hair transplant free of charge. And since it's for free, I mean, why not? I've since had third transplant done already, and since I've received my pre-operative pictures, we can compare to the previous ones to see whether there are any further improvements. And actually looking closely, sadly it doesn't really look any different. I'm currently just over 2 months after my third hair transplant, and I'm obviously going to be doing a further update video on this, so make sure to subscribe to the channel, don't miss this out. And now finally I've received confirmation to see my medical records online, so let's have a look. It starts from full blood count, etc., which looks like it's all in a normal range. Echocardiogram, which is potentially the most worrying part for me as it relates to pericardial effusion, obviously. It says it's normal. That's a huge one, as I was seriously freaking out. Such a shame there isn't more any explanations on it. I guess it's just done with an average patient in mind, not someone like myself who is obsessed with research on literally everything. Well, we see here blood pressure readings done. These were done at my GP's office late in the evening. So initially on first visit the number were quite higher, like it was 142 on 77, but my GP reassured me that it's possible simply due because, I can be stressed or be active before coming to the GP practice and stuff like that. So I've proceeded to check my blood pressure and heart rate for a whole week afterwards, twice a day, morning and evening, just to see what's an average. And what I found was that I had a 120 on 67 in the morning and 129 and 65 in the evening as an average throughout the whole week. A week or so after that, when I went to GP, he recorded 120 on 77. So that kind of, goes in line with what I found myself. I've also checked pulse rate, which was an average of 63 in the morning and 71 in the evening. And just for reference, I got a record of my pulse rate from back in 2018, which was 72 beats per minute. So that looks to be the same. Electrocardiogram, for whatever reason, isn't appearing here, but my GP, well, I've done it, and my GP has mentioned that everything was fine. It looked within normal range. I also have it done actually back in 2019, just before actually my first surgery, I believe, which was normal as well. And again, such a shame there's no diagrams or anything where we can, look more closely into to analyze ourselves, essentially. Standard chest X-ray, normal. That's another big one. No evidence of abnormality to account for the pain. The lungs and pleural spaces are clear. The heart is within normal limits. So it seems everything is well within the normal ranges, which means I do not have any side effects from oral minoxidil. Well, or at least there is no evidence of it. But the question stayed the same. Why did I have shortness of breath or chest pain? Well, my GP actually explained to me that, things like that can happen due to a variety of, factors like stress, lack of sleep, like malnutrition. Obviously, such answers don't really satisfy me, but again, since all the results came back normal, I guess I just have to, you know, keep monitoring it. And quite frankly, since then I didn't had any issues, you know, like chest pains. I do still have shortness of breath just because I need to start running. I was trying to find some other excuse, but no. It's been now well over 3 years since I've been taking oral minoxidil 2.5 milligrams a day, and sadly it didn't work quite as well for me that I was hoping to prevent third hair transplant, but here we are. And I'm planning to stay on the current 2.5 milligram dose a day for foreseeable future, and then rather to keep a higher dose in my back pocket should I ever need it. So that's been my experience. How about yours? Why don't you drop me in the comments down below how you get along with the oral minoxidil, whether you had any side effects. I'm sure a lot of people will find it very valuable.